Curriculum for Endoscopic Submucosal Dissection Training in Europe, European Society of Gastrointestinal Endoscopy, ESGE, Position Statement. Introduction. Endoscopic submucosal dissection, ESD, appeared more than a decade ago in Japan as a new method to achieve en-bloc resection of superficial neoplasms without any size limit. Since then, the technique has evolved greatly and shifted from the stomach to the esophagus and the colon. It expanded first to Eastern Asia, then to Europe and the rest of the world. The advantage of ESD over endoscopic mucosal resection, EMR, lies in its ability to achieve en-bloc resection of lesions regardless of the tumor size or the presence of fibrosis, avoiding piecemeal resection and consequently local recurrence. However, it comes with the drawback of longer procedure times as well as an increased risk of bleeding and perforation. For these reasons, the Western world remained cautious about implementing ESD for several years. One of the most important limitations for the spread of this technique outside Asia was the lack of local experts. Strategies to overcome this limitation have come mostly from Western endoscopists who individually visited Japanese expert centers and observed ESD on real patients. However, going to Eastern countries to learn this technique is not feasible for most Western endoscopists. Moreover, hands-on training on patients for foreign physicians is not easily nor legally allowed either in Japan or in other parts of the world. Therefore, there is a clear need for well-organized, comprehensive strategies to achieve good training in ESD. In this context, the European Society of Gastrointestinal Endoscopy, ESGE, initiated the development of this ESD curriculum for postgraduate training to improve and safeguard ESD practice in Europe. The recommendations presented in this curriculum are based on a consensus among endoscopists considered to be ESD experts who are involved in ESD training and training courses in Europe. Methods. The development of this curriculum is based on a consensus among expert practitioners of ESD who are involved in ESD training and training courses in Europe. On behalf of the ESGE Curricula Working Group Initiative, RB, ESGE Curricula Working Group Chair invited PPN to become ESGE Section Chair for the ESD curriculum. A call for participants opened in July 2017, and RB and PPN analyzed all the applications. Based on their curriculum, ESD experience, and publications, as well as motivation, in December 2017, the authors of this document were selected to become members of the ESD Curriculum Working Group. In February 2018, all the group members had a meeting in Düsseldorf, Germany. At this meeting, the methodology to be applied was discussed and different tasks were divided between the group members. 3 different tasks were decided upon. 1. What are the skills and competency requirements prior to starting ESD? 2. What are the training requirements? 3. What should the knowledge and experience be to maintain competence? Different PICO questions, where P stands for population or patient, I for intervention or indicator, C for comparator or control, and O for outcome, were defined for each of these questions. An evidence-based Delphi process was used to develop consensus statements. Literature searches were performed using PubMed or Medline, and preliminary sentences were proposed based on the available literature and expert opinion. In April 2018 in Budapest, the group members met again, discussed the proposed sentences, and agreed on standard terminology, the need for auditable quality indicators, and the formulation of the ESD training curriculum for trainees under expert supervision during the initial learning curve for clinical ESD. Based on all comments and suggestions, PPN and MP evaluated and grouped every statement and the evidence into a document with all the necessary bibliography, elaborating a first draft of the curriculum that was circulated among the group members in October 2018. Sentences were voted on online by all the group members. Discussion and an initial decision on the recommendations took place in a face-to-face meeting in October 2018 in Vienna, Austria. At this stage, changes were made if necessary, and sentences with less than 75% agreement were excluded from the curriculum. Sentences were voted on online again by all the group members, along with a further group of physicians not involved in the development of this curriculum, until a consensus was reached. Conclusions. This ESGE position statement comprehensively addresses the major steps in the ESD training program. ESD needs specific, meticulous skills and dedicated training to achieve competency. The ability to perform a curative resection by ESD without surgery allows us to provide significant benefits to our patients. The diverse topics covered in this curriculum include the baseline experience needed in diagnostic and therapeutic endoscopy before ESD training, the basic theoretical knowledge of the devices, strategy, and histological issues, the ways to obtain this knowledge, the initial hands-on training in animal models under supervision, the best choice of sites for the first procedures in humans under supervision, the number of procedures to become trained in the different locations, and the minimum number of procedures to maintain proficiency. As learning curves may be different from one trainee to another, this ESGE curriculum states a quality threshold for ESD in animal models of an en-bloc complete resection rate above 80% and no perforations in the last 10 consecutive procedures before starting human procedures. Once an endoscopist has started performing ESD in humans, ESGE also highlights the need to audit ESD procedures to monitor quality and safety. Throughout this ESGE curriculum, areas where further research is required to answer critical questions are highlighted, providing direction for researchers to design future studies. We look forward to the opportunity to incorporate the results of such studies into updates of this curriculum in the years to come.